The state health department now says nearly 15,000 people in our state are confirmed to have had COVID-19. 782 people are still hospitalized at this hour, and sadly 766 Coloradans have died. You may have heard the theory that the government is inflating the number of coronavirus deaths. Well, some others believe the number is being underreported. CBS4 investigator Brian Moss found that debate is now playing out in real time at a retirement home in Centennial, where people have been dying.
It's called Summer and Glen, and the state health department said the facility had a coronavirus outbreak this month after 4 residents died of COVID-19, which the facility acknowledged in this town hall.
Summer and Glen has had a particularly difficult time because they've had 4 residents' deaths.
But when 3 more residents died, it was a different story. In this letter, Summer and Glen said the physician has ruled their death as a result of other ailments for which they were receiving care. So doctors ruled they were non-COVID deaths. But the state health department officially categorized those other 3 deaths as COVID deaths, bringing the number of such deaths at Summer and Glen to 7.
Are these deaths being over-reported? Is the prevalence being inflated?
Dr. Kelly Lear, the Arapahoe County coroner, says that's the question arising out of this dispute. The health department told CBS4 it counted those 3 deaths as COVID deaths in accordance with the CDC's definition. When a person with a lab-confirmed case of COVID-19 dies, their death is automatically counted as a COVID-19 death, said the state health department, unless there's another cause that completely rules out COVID-19, such as a fatal physical injury. It's common for public health definitions for cases to be different from clinical diagnosis.
I don't personally think that there's a big conspiracy to overinflate the numbers.
Dr. Lear believes the number of actual COVID deaths may be undercounted due to people who died of COVID but their test was a false negative, or because people who died of the virus never showed symptoms and were never tested.
There are certainly a number of deaths that are not being counted.
Lear says when the dust settles, she believes the numbers will be fairly accurate.
And I think we're going to even out. We're going to be close enough that the data will be at least somewhat reflective of what's happening.
I'm Brian Moss, covering Colorado First.